Multiple sclerosis, MS, which means many scars, is an incurable neurological condition. It is characterised by an abnormal immune response that targets myelin, a fatty material responsible for the insulating of the nerve fibres in the central nervous system. This disrupts nerve impulses. Dr Julia Morahan is the Head of Research at MS Australia. She oversees the research funding and coordinating activities, including the MS Australia grant program. Dr Morahan began focusing on MS in 2009, which led her to work at Oxford University. She began working with MS Australia in 2012. It is a very, very privileged position I'm in to be able to speak to you today. Thank you so much.
Oh, thank you for having me.
So can we start with Dr. Morahan, what led you to actually focusing on MS?
So I actually started my research career in motor neuron disease, which is a neurodegenerative condition which is extremely severe. And I did quite a lot of my early research in that condition. But I switched to MS in 2009, as you mentioned, mostly because there was so much momentum in the MS field and so many amazing, interesting things happening and so many new treatments coming through the pipeline that we could offer people living with the disease and really feel like we were making a difference to people. So it was really the momentum that drew me to MS. And then we say in the research world, you tend to get trapped in MS. It's so interesting and important, and there's just so many different things going on that you can never leave. So I came across and I'm still here many years later.
Which we're really glad to have you. It is, as you said, it's such an interesting and complex condition to have. For listeners that might not know a lot about MS, can you explain what it actually does to the body?
So MS is what we call an autoimmune condition, which is where the immune system mistakenly attacks parts of the body. And in MS, in multiple sclerosis, the target of that abnormal attack is myelin, which is the fatty coating around the nerve fibres that send the nerve signals around the body. So once those attacks happen and the myelin erodes, those signals can't travel from the brain and the spinal cord to the parts of the body that they're connected to. So depending on where the damage is in the brain and spinal cord, people can have all kinds of different symptoms at all different times. So it can be quite unpredictable, but it is primarily an immune disorder that we're trying to limit the damage of.
When it's an autoimmune disorder like MS, it sounds like it's such a tough condition to try and understand. Like, how many years have people been working on the research and finding all the causes of MS?
So it is very complex, but I think we are making a lot of headway. So we do know quite a lot about how the immune system goes wrong in MS, I guess. And we are getting quite good at being able to stop the attacks of the immune system on the brain and the spinal cord using immunosuppressive therapies. So for people that have that phase of the disease, we're getting quite good at being able to treat that kind of cohort of people. The really interesting and difficult piece of research that's happening now is the repair piece. So what we're still struggling with is trying to repair damage that's already been done. But we have made a lot of headway with how the immune system works, and it is still a really exciting space.
A really interesting and tough space to be in. Is MS Australia's sort of main target to be curing MS, or are we focusing on trying to repair the damage, as you said?
So absolutely, curing MS is one of our pieces of our mission. We would love to be able to cure MS, and I think we are moving closer to that. I think we have tools in our toolkit, in our medication toolkit, as I said, for the immune system, but we really need the repair piece. And again, that would require lifelong management of the disease. So again, it would still be a chronic illness as you focus on in your program. So I think when I speak to people living with MS, lifelong management is not what they mean when they're talking about a cure. What they're talking about is never having to think about MS again, just not having it in their lives, just never having to think about it. So for me, in fact, for MS, I feel like that is prevention. I think the only way that we're going to be able to really get rid of MS for good is to prevent MS, and that is a big focus of our mission as well.
And that sounds like that's such a huge task, because are we talking it being genetic? Do we know how it even starts?
It is a huge task, but we do know lots about how it begins, and we know quite a lot about the risk factors for developing MS. So we know it's a group of risk factors, so no single risk factor on its own will lead a particular individual to develop MS. So some risk factors are genetic. We do know that there are some genetic changes that will increase your risk of developing MS, but we also have a whole suite of environmental factors like smoking, low vitamin D or UV exposure, and also more recently prior infection with Epstein-Barr virus, which is the virus that causes glandular fever, has also been shown to increase the risk of MS. So none of these on their own will lead a person to develop MS, but the constellation together, I think of it as a threshold. The constellation together, once you tip over the threshold, then you might develop MS once you have quite a few of those risk factors accumulated.
Wow. That Epstein-Barr virus seems to cause a lot of future chronic illnesses. I was speaking with someone with fibromyalgia as well, and their rheumatologist said that could have been a factor in ending up with fibro as well.
Yeah, it's so interesting because so many people have Epstein-Barr virus and glandular fever as children or as teenagers in high school, and most of those people don't go on to develop MS. So we know we say sufficient but not required but not sufficient, sorry. So it's definitely required, but the vast majority of people that have an EBV infection don't go on to develop these diseases. So we're doing quite a lot of research into what it is about the immune system of those people and potentially their reaction to EBV that does go on to lead to these other conditions, because it seems to be triggering something, but it's not doing it for everybody. So there has to be something different there that could give us some really good clues about how we could stop it.
Wow, that's so fascinating. That's such a lot to look into. The first signs of MS, in my interview with Cassidy, they're quite simple, and quite difficult to spot. Those first sort of that fatigue in there as well. How does someone get from fatigue to a diagnosis of MS?
Yep. So I think the key is that the MS is always there. And you're right, it can sometimes be quite difficult to diagnose. Sometimes because people with the relapsing form of the disease have symptoms that come and go, so they're not noticing them all the time and maybe not reporting every single one. And then sometimes it is because the symptoms are a bit diffuse, as you say. So a little bit of trouble with your eyes or a little bit of trouble with your hands that kind of sticks around for a couple of days and then disappears again, and then you don't think of it. So it can be quite difficult to diagnose. And again, that's because it's completely about where in the brain and spinal cord the immune system is attacking. So it can be kind of everything. And other things like pain or fatigue or depression that are a bit hidden, a bit invisible sometimes for the outside world, but we are getting much better at it. So we are learning to recognise things much more. People will generally go and have examinations and a brain scan using an MRI, and then we'll be able to diagnose much more quickly. So we're really happy with the movement in that space, time to diagnosis, but for some people it is still a really long journey.
Yeah, and a really, overwhelming and quite a stressful one as well. As
Absolutely.
researchers, it must be really difficult to be working on a condition like MS where, as you said, the symptoms can be so different for every person and change so often. How do you collaborate with other researchers to find those missing pieces?
Yeah, it's a great question. So, from a research perspective, from a biological mechanisms perspective, I guess the underlying mechanisms are the same. So, if you're the kind of researcher that's focusing on the immune system, for example, and the mechanisms that really kind of start the attack, then that's got a lot in common with some other autoimmune disorders and dysregulation of the immune system. And so, whatever we find about the immune system, we can use for people with MS, kind of irrespective of their symptoms, because the symptoms are a result of that attack. So that's why we have all of these immunosuppressive therapies that are working quite well. From a symptom point of view, it can be super unpredictable, and people can have very different symptoms even from themselves in a previous attack. So from a management point of view, it is very complex, and we do work very closely with what we call multidisciplinary teams who have all kinds of different health professionals in there to help people with their mental state, as well as physiotherapy and lots of other kind of assistance that we can provide to people. And all of those kinds of assistance pieces and social and applied research is applicable to lots of different conditions where, somebody needs a hand with their mobility, for example. So all of that kind of research is very much kind of cross-pollinated from other conditions as well.
It's amazing to see or at least, hear about all of the things that are happening and all of the research and all of the work that's going in behind the scenes that we just don't get to know about. In our chat with Cassidy, who lives with MS, she mentioned that the first 5 years are really crucial in terms of MS and within diagnosis time. Why is the first 5 years from diagnosis so important?
Well, I think from my perspective, um, it's about treatment. So we know now from research, a lot of Australian research actually, but also international research, that early intervention, by which I mean treating people as quickly as possible for their MS, is really crucial to stop the attacks. So I've mentioned a couple of times these disease-modifying therapies, the immunosuppressive therapies that we have. We know that if we get to somebody early enough in their journey, with a bit of luck, we can possibly hold them in the state that they're in at that stage, potentially for many, many years, if not the rest of their lives. If we can't get to them early, then those attacks will continue at different rates for different people, but eventually they'll get to the stage where the damage that is so great and we don't have those treatments to repair. So we're really trying to get to people in those early stages so that we can kind of stop the damage before it takes place, I guess, in order to make sure that we don't get ourselves into these kind of neurodegenerative state at the end. I think that's from my research perspective. Cassidy, of course, has her own living perspective, lived experience, and I think the other thing about the first 5 years is it's a huge life shift for anyone, and there are lots of research into self-concept and how your perception of how yourself changes and your perception of the world, and if you have family and children, and how you're worried about how your MS might affect your employment. So also the first 5 years is a very tumultuous time in terms of trying to come to terms with this potentially new idea of who you are and incorporating it into your life. So important for so many reasons.
So it's very much a mental and physical
Yes.
importance in that set time. Through all of my research, which is absolutely nowhere near the amount of research you do, we're finding that MS is actually affecting more women than men. Do we have a reason for that?
So this is really interesting to me. So we're not sure yet why MS affects more women than men. So the ratio in Australia is 3-1, so 3 times more women than men. We do have some theories. So genetics is one factor. So we know a lot about the genetic risk of MS, but the sex chromosomes, the X and Y, haven't really been looked at and are only being looked at now. So it could be something to do with the sex chromosomes. However, we also know that the number of women who are getting MS is accelerating. So that kind of points to more of an environmental factor, because genetics doesn't change quickly enough to explain the differences in the ratios that we're seeing. So it might be other environmental factors, such as differences in sun exposure and vitamin D, particularly in women. And it might be something to do with the sex hormone. So we know that MS changes throughout a woman's life in terms of her pregnancies, in terms of her adolescence and other kind of important hormonal times. So it may be something to do with sex hormones, but we're still looking into it.
Really interesting. So we could be blaming estrogen.
Yeah, I think there's definitely something there. It's just going to be quite intricate, and there's something about the timing as well that's going to have to be teased out, I think. But there's definitely a difference. Yeah.
Yeah, because there is that the average diagnosis is between 20 and 40. Is there like a particular like hormone level that women are at?
Yeah, I don't know if that's the reason for the peak. I was thinking about this, and I think the other thing that we know about MS is that it does occur across the lifespan, for want of a better word. So there is such a thing as pediatric MS, and between 5 and 10% of people are diagnosed with MS as children, in children as young as 2, in fact, and it can be diagnosed in the very old. So we're not sure why MS onset occurs in the time frame that it does in most people, but I think it is something to do with the genetic and environmental interactions that lead to that development and making it obvious to the point of diagnosis around that time.
Well, 33,000 people are living with MS in Australia, 2.8 million worldwide. I do feel like there is quite a lot of, not quite a lot of, but you do get media attention around MS, especially when celebrities happily say that they've got it and are, and bringing it forward into the light a little bit more. Do you think there's still really a long way to go in regards to that recognition and helping to find that cure? Does the public know enough about MS?
The short answer to that is yes, we need to do more. But the slightly longer answer is that we know that MS is well recognised. People have heard of it. They possibly know a person living with MS or have a relative living with MS. But when we talk to people and dig a little bit deeper with our research, an actual understanding of MS is missing. So they know the word, they know the name, but they don't really know how it works or what's going on for the person. And MS is sometimes referred to as an invisible disease, which you know very well. It's exactly the topic of this podcast in some ways. So people are able to potentially live with MS, but hide it from a lot of people. Employers are unfortunately a good example, and sometimes family members. So really more information, more education, more resources for people living with MS themselves, but also the wider community, so that they can understand the different aspects. One, that it can be invisible. So if somebody living with MS is trying to tell you something about their condition and you can't see it, that doesn't make it less true. And also the wider community to understand that it's very unpredictable. So I think a lot of people living with MS have said to me that the unpredictable nature of the way that MS works and the fact that we're unable to predict the attacks by the immune system is actually one of the most difficult things to live with. So absolutely, I think we definitely want to have as much information about MS out in the world as possible.
Yeah, absolutely, because having an invisible disease that you have no idea what it's going to do to you next is very difficult to deal with. In your position as head of research, you said earlier there's constantly changing, there's amazing new things happening. What in research and in some treatment developments for MS has excited you the most?
Yeah, thank you for this question. So I think, as I said before, we're doing pretty well with the immunosuppressive therapies for the relapsing forms of the disease. Having said that, there's still developments all the time of new treatments coming through that are more effective, easier to deal with, and less side effects for that group of people. We just had the PBS subsidise a injectable form of a medication for MS that had previously been only available on infusion. So there are advances all the time in that space. I think the thing that's exciting me the most at the moment is this possibility for repair. So that's either, for me, it's two categories. One is what we call remyelination, so getting the myelin, that the coating on the nerve cells, to grow back and repair the damage that's happened, or neuroprotection, which means helping the brain and spinal cord protect themselves better from the damage in the first place and kind of limiting the damage that way. So we have recently announced as MS Australia a new type of clinical trial that we are going to be launching for people with progressive MS. So those are the people with less treatments available, called Platypus, and it is looking at repurposed drugs, so drugs that are out there in the world for other diseases that we think have remyelinating or neuroprotective properties, to see whether we can kind of get some repair happening in people with progressive disease. So I think for me, that is a huge shift in the way that we both think about progressive disease and the treatments, but also the way that we're doing clinical trials. And we've linked up with a similar program in the UK called Octopus, which is running very well. And I'm super, super excited about whether or not we can get some repair happening using this new clinical trial.
That's incredible. So the trial may potentially be able to show a complete reverse. So if they're struggling to walk, they may be able to start again?
That's the dream. That would be an ideal scenario. I think at the moment we're trying to get some function back and some repair just on biomarker measures, so different measures throughout the clinical trial. That would be perfect. We have a very long list of things to test, and I think the exciting thing for me is that the method of the clinical trial, or the way the clinical trial works, means if something's looking like it's not working, we can swap it out and put something else in, and we don't have to run the clinical trial for the full 2 or 3 years that we normally would do in a traditional setting. So it's also accelerating those answers. So the answers aren't always going to be perfect. A lot of things may or may not work, but if something's not working, we can kind of take it out and put something else in, and we have a long list of things to test. So this is something that we've been thinking about as a field for a really long time, and we're just thrilled to be able to bring it to people living with MS in Australia.
Oh my gosh, I'm so excited for you.
Yeah.
These clinical trials take forever. And
Yes, exactly.
To start again. This is
Yeah, exactly. So they've been doing it in oncology for a really long time, but it's the perfect fit for progressive MS because, as we discussed earlier, time is crucial. We say time is brain, and people with progressive MS don't have time to waste. So asking them to sit through a potentially negative 3-year clinical trial is just not. It's not a great model. So we're thrilled, and we're very, very hopeful that this will lead to a bit more awareness of this design. It's called an adaptive clinical trial, and the use of this in other diseases as well.
Wow. Oh my gosh. I'm sending you all the good vibes, and I really want that to work for you.
Yes. Also me. Thank you.
What do you hope for the future of people working with MS and the people that are actually living with it?
Well, I think it is. I mean, it sounds repetitive, but it really is. I really want to be able to, as a field, crack this nut for repair for the brain and spinal cord, because that will also have huge implications for other neurodegenerative diseases, which are quite severe as well. And I think that's the next piece. So from a research perspective, we do know a lot about the immune system and what's happening in MS. The next piece is going to be all about the brain and trying to make sure that we can get that piece to try and be able to fix MS. So I think that's my hope. My hope is that with platypus and with lots of other work that's happening in Australia and around the world, that we will be able to repair damage and MS will become a manageable condition. So you take an immunosuppressive therapy and you take a repair therapy or a neuroprotective therapy, and it's manageable from the outset. So I think that's the dream, and that's what we've been working towards and continue to work towards.
That is absolutely brilliant. Are there any new developments or programs happening at MS Australia that you can tell us about?
We would say that the Platypus platform is our newest initiative, and we are kind of fundraising for that and very excited to be fundraising for that. And our major fundraising campaign is called the May 50K, which is a virtual walk where you walk 50 or run 50 kilometres or roll 50 kilometres over the course of the month of May. And all of the proceeds for that go towards research funding. So we'd be very delighted if people wanted to join that campaign.
Absolutely. It sounds like an amazing campaign. Thank you so much for joining us on Chronic Convos, Julia.
No worries. Thank you so much for having me, Mia.
Thank you, Dr. Morahan, for joining us on Chronic Convos. For more information on MS, the MS Australia website is a fantastic resource. There is a link in our show notes. If you'd like to hear from someone who's living with MS every day, episode 1 of season 1 has Cassie Krieger discussing her life dealing with MS every day. This podcast is recorded on Wadawurrung country.